All right, good afternoon, everybody. We'll get started. Hopefully you all can hear me clearly. Please, if you can, via the chat, let me know that you can hear me clearly. My name is Isaac Reichman. I am the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection. In today's webinar, the fourth out of our 5 industry-specific webinars on the reopening plan for the City of Chicago is titled The Overview of Chicago's Reopening Plan for Retail. So today, I will provide an overview of the reopening plan for retail stores in the City of Chicago. A little bit of housekeeping before we get started. Thank you to everybody for confirming that you can hear me clearly. If you're having any trouble with the audio, please adjust the speaker volume on your end. So over the course of this webinar, which will last until 1 p.m., I'll provide an overview of Chicago's reopening plan specifically for retail stores. There will be opportunity for you to submit questions. Please do so through that chat function that you just used to tell me that you hear me clearly. Please do not use the Q&A. It's much, for me to be able to handle the questions as they're coming in, I need them all to be kind of in one location, so please use the chat for that. That's the easiest way for me to view questions and hopefully answer them over the course of the webinar. Quick point about the question, we do have a high number of attendees, and I'll do my best to answer every question as they come through. But I may not be able to answer every question, either because we don't have time to answer every question, or because I need to check with some other folks in order to provide you a fully accurate answer. We work very closely with our health department and with other departments. So some questions I get, I will need to run by our health department, for example, to make sure that I'm giving you the full and proper answer. So that is why you'll see on the bottom of every single slide this BACP outreach at cityofchicago.org email address. Any question that I do not answer over the course of the webinar, and I apologize in advance if I don't get to all the questions, can be submitted via that email address. And we'll work to get you an answer as soon as possible. I know there's a lot of questions right now, and we will work to get you those answers as quickly as we can. Another quick point before we get started with the content of this webinar. I want to talk a little bit about the events over the last few days and their impact on the business community. As I'm sure you've heard, the mayor has announced that we are moving forward with reopening, with moving to phase 3 of our Protecting Chicago framework. That we are doing that today. That Chicago is officially in phase 3 and can officially begin cautiously reopening. Now we know, as the mayor has said, that many businesses have been impacted, obviously, by the events of the last few days. And the mayor, the health commissioner, and the police commissioner look very, very closely at what has been going on public safety-wise and what's been going on health-wise to make sure we're still ready to move forward. And they've determined that we are still ready to move forward with this plan today. And that isn't something that they came to lightly. They looked closely at the health metrics and what was going on public safety-wise around the city to determine that it's still appropriate to move forward. That being said, a couple things. First, we know that not every business will be ready to reopen today. We absolutely know that. We know that every commercial corridor is different, as having a different impact from what is going on right now. So we ask that you work closely with your neighborhood business association and with your local police district to determine the best options for moving forward. We also ask that you sign up for notifications from the city at notifychicago.org. And I'll put that into the chat so folks can see it. So that way you can get the latest updates on what's going on around the city so you can prepare accordingly. And finally, we know that businesses have, that have been impacted are looking for support right now. And on the short term, BACP is working closely with our chambers, our local business support organizations, to get support resources delivered into the community where they're most needed. So please, again, work with your local chamber. If you don't have a relationship with your local chamber, you can find more information at chicago.gov/NVDC. And then also going forward, yesterday the mayor announced that she'll be establishing a $10 million relief fund for businesses in need of immediate support. More information on that will be coming. We don't have the full details yet, but we'll make sure to communicate that out to all businesses as soon as possible. So with that little introduction, I want to get into the agenda for today's program. So as I said, we will be discussing what phase 3 means for retail as we begin cautiously reopening. I'll provide an overview of phase 3, how we got here, and what it means for everybody, not just businesses. I'll then talk in detail about what guidance we've given to retail shops as they prepare to reopen, including what is considered retail. And then finally, I'm going to provide an overview of those resources that are available to retail shops as they begin to reopen. And finally, before I get into the specific content of today's webinar, I want to plug this email address and this website, and I'll continue repeating it throughout this presentation. If you have not visited chicago.gov/reopening, strongly encourage that you do so today. This is where you can find all the resources you need, and most of those questions that you have will be you will be able to get on that website. So please do check out chicago.gov/reopening so that we can get you so that you can read the specific guidelines and get more information there. And I'll talk a little bit more in this presentation about what you can find at chicago.gov/reopening. So first, I want to talk a little bit about what phase 3 means as a whole. Again, Chicago is shifting to phase 3 today, and we're very excited that our health metrics are such that we are ready for this. So what does this mean? And want to make it very clear what we mean by phase 3 and what we mean by reopening. This is not a light switch turning on today. This is, as the mayor has said numerous times, this is a dimmer switch that we are slowly turning as we shift into phase 3. The goal is to reopen safely and cautiously while keeping our community safe. So for work, what does this mean? Non-essential workers can begin to return to work in a slow and phased way, as I'll talk about in a little bit more detail over the course of this presentation. Certain businesses, nonprofits, city resources will open with appropriate protections for workers and customers. What does this mean for you in your life? So we're shifting again from stay at home into cautiously reopening, and the city slogan is shifting accordingly from stay home, save lives into be safe, Chicago. So you can begin having more limited social gatherings, limited to 10 people or fewer. That's going to be your magic number of gatherings throughout this phase and throughout different industries, 10 people or fewer. When meeting others, you should be physically distancing and wearing a face covering. Across all industries, the guidelines say face coverings are required. And when you're meeting others, that 6 feet of social distancing is the requirement. And again, public amenities will begin to open in a phased and slow way. Finally, what does this mean for your health? And I think the most important thing that everybody here can take from this presentation, in addition to the specific guidelines we'll cover, is that we're not out of this health crisis. We are still in the midst of this pandemic, and that has not changed. While we have made significant progress that our health department commissioner has spoken to, and that I'll go over in a little bit more detail, we're not out of the crisis. So if you are sick, you need to stay home. If you are an employer, you need to let your workers stay home if they are sick. We have an anti-retaliation ordinance in place That means that business owners cannot retaliate, cannot fire, demote, discipline workers if they are staying home and they are sick. This is critical for us to continue the life-saving progress we've made over the last few months. And the mayor has made it very, very clear she will not hesitate to shift us back into phase 2 if it's necessary. That's the last thing we want, but we will do it if it's necessary. And you need to continue to physically distance yourself from vulnerable populations, particularly the elderly and those with underlying health conditions. We know that they are at most at risk of COVID-19 and most at risk of having serious symptoms from COVID-19. So you need to continue physically distancing yourself. And you should be getting tested if you have symptoms. Early on in this crisis, I know that we were recommending folks that did not have that had symptoms or were otherwise healthy and did not have underlying health conditions to not get tested, to limit the test for others. But now we've expanded our testing and we have testing available for everybody that needs it. We strongly recommend if you have symptoms, you should be getting tested. So why are we ready for phase 3? I want to make it clear this date wasn't arbitrarily chosen. This wasn't, hey, let's just pull open a calendar and pick a date. This is based on health metrics that the health department and the mayor established about a month ago and said, hey, if we reach this level on these critical health metrics, if we reach these metrics, then we will be ready to transition to phase 3. And we're happy to say that all the metrics set by the health department have been met. So what does this mean? We have a declining rate of new COVID-19 cases across the city, across different ethnicities, across different geographies, and across different settings. We're also having a stable or declining rate of cases that result in hospitalization, ICU admission, or death. That's ultimately what we're trying to do here, is save lives. And we're having a declining rate in cases resulting in death. We're also having a declining proportion of emergency department visits for influenza-like illnesses or COVID-like illnesses. This is something our health department tracks every single year. What percentage of cases that are at the ER are there for influenza-like symptoms? And that has peaked during the COVID-19, the peak of the crisis, and has been declining. How about our hospital capacity? Basically, what about folks that, how can we handle a spike? What if we were to see a spike a month, 2 months from now? Would we be able to handle it? And we're happy to say that the city of Chicago has had adequate hospital bed capacity, adequate ICU bed capacity, and adequate ventilators in place throughout this crisis, which is wonderful news. And that's something we'll continue to monitor closely to make sure that we are ready to handle a spike if there were to be one. Next, what about adequate testing capacity? It's essential that we're able to test people in order to make sure that we have a good grasp on this crisis. And our goal has been 4,500 tests a day, which comes to 5% of Chicago's residents per month. And right now, we're able to test over 5,000 a day. And that's wonderful news. That means we have the capacity to really understand this pandemic and how it's impacting our residents. And next, what about the percent positivity? Overall, our goal is under 20% of tests are positive. And we're happy to say we're at that goal. And that means under 30% positive tests at congregate settings, places like jails, nursing homes, places like that. And under 50% positive tests at community settings, general folks out in the community. As the health commissioner just announced yesterday, we're happy to say that we are at that goal. Finally, and this is all about the long-term plan, do we have an adequate system in place for congregate and community investigations and contact tracing? We're happy to say we do. Mayor announced last week a robust contact tracing plan, so we're very excited to say that we are ready to go in that regard. So the reason why I start with this and don't just jump into the specific guidelines for retail is it's critical that you, the business owner, understand why we're ready to go to phase 3 and that it is based on health metrics and that this is all about keeping our community safe. We know that we've asked so much of our businesses over the last 3 months. We know that it has been incredibly challenging. But we want to make sure that everything is couched in the health terms. The reason why we're doing everything we're doing is because of the health reasons, and we'll be continuing to monitor these as we go to phase 3, phase 4, etc. I see a couple questions coming in. I do want to make sure to get through the guidelines because I think some of those will be answered, and then I'll make sure to take a break and answer those questions. So what's opening under phase 3? Obviously, today we are here to talk about retail stores, but that's not the only thing opening up under phase 3. Childcare will be reopening. It means childcare centers and family childcare. City services will be reopening in phase 3. Quick note about that. City services will be reopening beginning June 8th. And this does not mean every single city service. We're talking about parks, libraries, some other limited things that have been fully closed. For example, BACP's offices will remain closed to the public under phase 3, most of the offices. Now that does not mean, and we have been continuing to process licenses and permits, and we will continue to do so. But I do want to make sure that that is clear. City services, parks, and libraries will be reopening June 8th, but that does not include all city services. Office and real estate, office-based jobs, professional services, real estate services can begin reopening. Hotels and lodging, outdoor attractions, which includes boating. The lakefront will remain closed. So boating on the Riverwalk can happen, but not on the lakefront at this point. Same with golf courses. Golf courses can reopen, but not along the lakefront. Personal serve, in addition to retail stores, personal services, hair, nail salons, barbershops, tattoo parlors, massage establishments can reopen with strict guidelines in place, and also health and fitness centers can reopen. Finally, food services can reopen, restaurants, coffee shops, for outdoor dining only. So, what do we mean by, or quickly before I get into retail, let me clarify some things that will not be reopened. While many, many services will be reopening beginning today, some stores will not. Bars, lounges, breweries, places that only sell alcohol and do not have any food service cannot reopen. Some other outdoor activities, pools will remain closed for now. Large event venues will remain closed. Museums will be reopening in phase 3, but we do not have a specific date for them yet. And those things that will be remaining closed at this point, we do not have a date for them, but we will be sharing them as soon as possible. Right. So when I say retail is reopening, what do I mean? And this is a really important question because in our use of the retail term in these guidelines, there is a wide range of retail. Basically, everything that was non-essential under the stay-at-home order under retail can now be opening up fully, or not fully, but under strict guidelines that I'll be recovering here. But they can be reopening. So clothing, shoes, department stores, jewelry, luggage, leather goods, furniture, things like that. Stores that were closed under the stay-at-home order or open just for curbside pickup and delivery will now be able to open under these retail guidelines. Groceries and convenience stores, specialty foods, beer, wine, liquor stores, all these places that were considered essential are now still following these retail guidelines. So obviously many retail stores were already open under the stay-at-home order. Pharmacies and drugstores, cosmetics and beauty supplies, optical goods, all can now reopen under the retail guidelines. Pet supplies, office supplies and gifts, books, newsstands, sporting goods stores, hardware stores, home furnishings, electronics, and then even places that are really more services than retail, such as car washes, should be using the retail guidelines in order to reopen. Couple points about this. If you're not 100% sure whether your industry should be reopening under the retail guidelines, there's a couple things you can do. First, you can send an email to BACP Outreach, or you can call 311. We have a COVID-19 dedicated line there, and we can help provide a little bit of clarity. But really, the guideline, and this is, you can find this on the reopening website. We encourage businesses to use their judgment as to what industry they fall into. You know, we've made clear which ones should not be opening. Again, bars, lounges, large event spaces, places where there are gatherings of over 10 people. But beyond that, places can reopen. And you should be using your judgment as to what exact industry you fall into. You know, if you offer one-on-one personal services, then you should be under the personal services guidelines. If you're more retail and you're not having one-on-one close interactions with people, then you should be falling under the retail guidelines. If you're selling food for consumption, you should fall under food services. Again, happy to answer any of those detailed questions, but really we're asking business owners to use their judgment as to what guidelines they fall into. And I do see a couple questions come through related to that. I'll do my best to answer them when we get a little bit further through, because I think some of them might be answered. But if I do not answer them, again, BACP Outreach at cityofchicago.org. So what can you find under on chicago.gov/reopening? And again, I'll put this into the chat so you have this website. If you haven't checked it out, I strongly recommend visiting there today. So on this website, you'll find detailed industry guidelines, which were developed by large industry working groups based on the direction of our health department, the CDC, and other global benchmarks. So you'll find these retail guidelines that I'm going to review today. You'll also find guidelines for all other industries. So if you're curious what your residential building should be operating under, you can find that there. If you're curious what the CTA is experiencing, you can find that there. Next on this website, and I'll go into a little bit more detail on this later in the presentation, you can find a self-certification pledge. Employers are encouraged to complete a self-certification questionnaire to show support for phase 3 of reopening. Finally, you'll find national resources, posters to download, FAQs, things like that, all on that website. Again, any questions you have can be made to the COVID-19 311 hotline, or again, you can send them to BACP Outreach at cityofchicago.org, and me or someone from my team will follow up as soon as possible on those questions. So what can you find in those guidelines? I believe we have 14 guidelines currently up on that site, and we will be adding more as other industries reopen. And all of them are kind of split up into and separated and organized into the same category. Talk about healthy interactions. How can you, the business owner, ensure that there are healthy interactions between your employers, employees, and customers and clients, contractors, distributors, things like that? So social distancing, how can you ensure social distancing? Again, the magic number for social distancing is 6 feet. Anytime we talk about social distancing, for you, your business, your family, we're talking about 6 feet as that magic number. How can you minimize gathering sizes? The magic number for gatherings are 10 people. And let me be clear about that, and I'll go into it in a little bit more detail. Gathering does not mean the total number of people in your store. Gatherings mean people gathered together in close quarters, all for the same purpose. So if you go over to a friend's house, for example, you should be limiting that to 10 people. So when we talk about gatherings, I'm not talking about capacity. Those are kind of two different things. Protective gear. What sort of protective gear should be in place for your workers and for your customers? Which you'll see across industries, face coverings is the thing we're really recommending and requiring for everybody, with a couple specific requirements for different industries. And then what requirements are in place for hygiene? How can you keep everybody practice proper hand hygiene, sanitizing, things like that? So in addition to healthy interactions, what can you do to keep your space safe and set up conditions so that everybody is safe and healthy throughout your reopening? So entry access, what can you do to make sure people are not entering with COVID-19 symptoms? What are the standards you should follow for cleaning? What is the visual guidance you should post, and what sort of conditions should you ensure are up to speed and are ready to go at your location? Finally, operational resilience and monitoring. How can you make sure that your customers and your workers stay safe into the future? So travel guidelines, how to test, how to track, how to have flexible business models to make sure that you are following the proper guidelines and keeping everyone safe. Because again, we know that businesses want to keep people safe. We know businesses want to do the right thing, and these guidelines make sure you know how to do that. So that means, while I will review all of these, I do recommend that you visit that reopening site, that you can read these in detail, you can go back and reference them. There will also be a glossary, a self-screening questionnaire, and other public health resources. You really should have all the resources you need, and then as I said, we're here to answer those questions. So without further ado, I'm going to jump into a little bit of detail now on the industry-specific guidelines for retail that is reopening. One quick point, as you know, essential retail has been open throughout this time. So let me be clear about that. A lot of these guidelines have already been in place for grocery stores, hardware stores, banks, places like that that have been essential. So a lot of the best practices and a lot of the guidelines are already in place. Then you'll see them when you visit a grocery store, stuff like that. So what are the requirements? The first page provides an overview and a little bit of a visual on what you should be seeing. Customers should be maintaining physical distance while in the store. And you, the business owner, should be posting guidance and encouraging and making sure that conditions are such that they're able to maintain 6 feet in the store. Impermeable barriers may be used to maintain separation between employees and shoppers. This is something that we are encouraging, impermeable barriers. Number 3, you should be disinfecting stores frequently. And then relatedly, you should be having sanitizing products readily available for use. Customers are encouraged to use contactless payment. That's something that a lot of retailers have ramped up over the last few months, and we're strongly encouraging folks to continue doing so. Number 6, customers and employers are required to wear facial coverings at all times. Let me be clear about this. Facial coverings are different than face masks. Face masks are, a mask kind of that goes a couple inches in front of your face. We really are saying face coverings, more of, face guards. When I say facial covering, I mean things that are closely covering your nose and your mouth. I'm sorry if that was a little confusing. I apologize for using the wrong language there. Facial coverings that are closely covering your nose and your mouth. A face shield that is a few inches away from your mouth will not suffice. Face coverings actually covering your nose and your mouth. Then finally, you should be placing 6 feet indicators out the store to maintain social distancing, especially in places where customers may queue for a line. And obviously then, especially as they are waiting in line. So let me go over this in a little bit more detail. First, that social distancing requirement. Again, the magic number for social distancing is 6 feet. You should be providing 6-foot markers, floor markings, in any area where guests or employees queue or congregate to ensure appropriate social distancing. If 6 feet of social distancing is not possible, where practical, you should be providing impermeable barriers. We know for certain businesses, particularly with the cashier, that maintaining 6 feet of social distancing is not possible. If that's the case, where practical, you should be providing impermeable barriers. Again, your magic number is 6 feet. Your customers should, you should be making it very, very easy for your customers to ensure 6 feet between them and other individuals. You should also be limiting gatherings and limiting capacity. So what does capacity mean? You should be limiting your capacity to 25% for non-essential retail and 50% for essential retail. And this is excluding staff. So first of all, what do I mean by essential versus non-essential? Hopefully by now, over the last few months, you should know whether your business is considered essential or non-essential. Essential businesses are those that were deemed essential under the stay-at-home order. Places like hardware stores, grocery stores, pharmacies, banks, auto shops, places like that that were considered essential and were allowed to open under the stay-at-home order. Those places should have 50% capacity. Non-essential retail, which was just allowed to reopen beginning today, places like clothing shops, furniture stores, and beauty supply stores, retail that was non-essential and is now allowed to cautiously reopen, you should be limiting your capacity to 25%. First, what's the reason for that? As I said before, we're talking about reopening as a dimmer switch, not as a light switch turning on. And we want those folks that have not been open for 2.5 months and that have not had proper safeguards in place to slowly and cautiously ramp up their operations. It won't be 25% for, for months and months, but this is about slowly ramping up our operations. So how do you calculate capacity? We know some big stores do have already occupancy placards, capacity officially designated, but we know a lot of small retail shops do not. For those that do not, we are, and you can find this in writing on our chicago.gov/reopening site, for those that do not have an official capacity and do not know their official capacity, we're asking you, the business owner, to basically determine what is your typical maximum capacity and then to divide it by half or divide it by a quarter. This is, again, on you, the business owner, to determine what exactly that means for your business. Next, you should be limiting your gatherings. Again, the magic number for gatherings is 10 individuals. So any place in your business where there might be a choke point, where people might gather together for whatever purpose, should be limited to no more than 10 people. Probably the most prime example of this is break rooms. If you have a large retail shop and you have a break room where you have multiple employees taking a break all at once, all in that same gathering area, that space should be limited to 10 people. And you should also be ensuring 6 feet of social distancing there. So again, your magic number for gatherings are 10 individuals. You should be ensuring that protective gear is worn by all employees and customers. So what does this mean for retail? This means face coverings over your nose and your mouth. Again, these need to be things that are tight over your nose and your mouth. A shield would not suffice. There can be exceptions, as always, for people with medical conditions or disabilities that make it so they cannot medically tolerate a face covering. You should also be providing grocers with gloves, following standard food handling protocols. That probably and hopefully is not something new for grocers, but that is a requirement that grocers should be provided with gloves. You should be ensuring hygienic interaction for all customers and employees. This means providing sanitizing products for customer and employee use. For example, if you have carts, you should make sure that there is sanitizing products available for the customer to sanitize them before use. And employees should be washing their hands before and after every service. You should also be prohibiting store employees from handling reusable shopping bags. Customers may bring them in, but they should not be handled by store employees. If you have any store-issued clothing items that are kept in the store after each shift, they should be cleaned after each shift. and encourage employees to clean if they're keeping them at home. Encourage employees to clean them after each use. Next, I want to talk about entry access screening measures. So you should be implementing a screening measure for employees to self-screen before they enter your establishment, before each shift. So what does this mean? Are we requiring a temperature check? No. Businesses are not required to do a temperature check of their employees. Now, businesses can do more than what we're requiring, but at minimum, we are requiring a self-screen to ensure that employees are asking themselves questions before they enter your establishment at the beginning of their shift to make sure that they do not have symptoms of COVID-19. And critically, employees should not be reporting to or allowed to remain at work if they are exhibiting symptoms or feeling ill. Again, this is a self-screen that employees must ask themselves before going to work. And the language for this self-screen can be found on the guidelines themselves, again, at chicago.gov/reopening. What about for customers? You should be providing markers outside for customers as they queue and line up to come into your store. So you should not, even when they're outside of the store, you should be providing some sort of marker to make sure that customers are queuing 6 feet apart. You should also be establishing daily cleaning standards for spaces and high-touch items. All high-touch areas, carts, baskets, self-serve checkout equipment should be disinfected between each customer. You should also, if fitting rooms, you should be sanitizing them after each use. And then you also should be sanitizing restrooms hourly or as appropriate. Next, you should be providing visual guidance on hygiene standards and entry requirements. So you should post signs out your facility for social distancing, face coverings, especially at the entrance and checkout. And these postings you can find at our website, again, chicago.gov/reopening. So you should also be modifying your workplace operations. What does this mean? You should be decommissioning any self-serve or communal food locations and any indoor food seating areas. This brings up an important point. If you are a retail grocery store, for example, but you also have a quasi-restaurant coffee shop space where you have food that can be purchased and people can sit and eat it, you should be decommissioning any indoor food seating areas. Outdoor food seating areas can remain open, but indoor food seating areas cannot. Great. If there's only one bathroom on premise, that should be reserved for employee use only. And if you have more than one bathroom, please reserve one for employee use only and others for public use. So again, you need to be reserving a bathroom for employee use only. You also, if practical, should be adjusting store navigation to ensure social distancing. One-way aisles, or if, depending on your exact layout of your store, if there are certain choke points that lead to close gatherings, you should be widening them as much as possible to ensure social distancing. Right. You should be limiting in-person work where possible. What does this mean? Obviously, we're reopening. Retail happens in person. But as much as you can, you should be minimizing these in-person interactions. Online, for example. If you have staff meetings, you should continue doing them remotely. There's obviously many establishments have shifted to virtual remote staff meetings, so we should be making sure that that we don't just immediately stop doing all that. And if employees can work from home, please ensure that they continue to do so. This is a dimmer switch. We're not fully and immediately opening this city. You should be limiting interactions between individuals. I know many of you have set up curbside delivery, curbside pickup, on-site online delivery, carry out, things like that. and contactless payment and self-serve checkout. All those things should be encouraged just because we're reopening. If you establish a robust curbside pickup plan, keep that in place. This is still the best way to prevent transfer of this disease. Specifically for full service groceries, you should be implementing shopping hours specifically for vulnerable populations at least once per week for 1 hour at the beginning of the day, at minimum. You know, this is particularly for grocery stores in particular. You should also limit travel for business. If you have multiple retail shops, staff should really just be working at one of those shops. They shouldn't be traveling across multiple retail locations. And that's, you know, pretty self-explanatory. The fewer people you interact with, the fewer chances you have of transferring this disease. Finally, and this is guidance for all businesses, you should be following the health department and CDC guidelines for testing and tracing protocol. If an employee does contract COVID-19 first, you should all be prepared for that scenario. It should not be a surprise. You should not be unprepared if an employee does contract COVID-19. Obviously, we've had thousands and thousands of cases in Chicago, and we do expect that we will still have thousands and thousands more. So you must be prepared. There's CDC guidelines that they should be following before returning to work. And I'm not the health expert, so please do feel free to reach out if you have any specific health questions, and I can connect you with the health department folks that are taking the lead on that. You should be cleaning and disinfecting workplace according to CDC guidelines when if a worker does become diagnosed with COVID-19. Anyone who has had close contact with a coworker or anyone else diagnosed with COVID-19 should also quarantine. And if a facility has 2 or more cases possibly associated with the establishment, you should report those cases to the health department, and they can help you determine the best procedures going forward. Great. I do have a couple more slides that I want to get into, but I want to take a minute to answer any questions that might have come in about these guidelines or anything else that I have not covered over the course of this presentation. So if you have any questions, please do submit those again via the chat. And I do, you know, I may not be able to answer every single question. If I am unable to answer it, I will ask you to please submit that via the outreach email. Great. We have a couch inside our shop. Should we cover it or put a sign not to use it? So the important thing with anything that is touched by multiple people is that you're sanitizing it between use. So if that's not possible, then we would recommend that you cover it or put a sign on it not to be used. Right. So I got a question about the rationale between not yet opening the lakefront facilities. So again, I'm not the health expert, so I cannot go into detail on why the mayor and health commissioner have made that determination. But I do know that even when outdoors, large gatherings can lead to easy transmission of this disease. And the idea behind keeping the lakefront closed is to minimize large gatherings. And we know that this is a challenge for so many people that love our lakefront, myself included. And you know, it's something that a sacrifice that we are continuing to make in order to keep ourselves safe. Great question. What can you do if you've experienced retaliation from your employer if you've had COVID-19 and missed work? We ask that you please submit complaints to 311. BACP's Office of Labor Standards handles those complaints, and we will be responding to those complaints and addressing them as needed. Great. Give me one more second to look through some of these questions. So I got a question about Navy Pier retail. That's an important question, and if you follow up via the email, I will get you more additional details about Navy Pier retail. But for now, under Navy Pier, only the outdoor space is reopening at this point. Again, if you have any additional questions, or if I did not answer, and let me make sure, I think I went through most of the questions I got. If I did not see your question, I do apologize. Please, again, follow them up on BACP outreach at cityofchicago.org. Great question just came through. Any word on museum retail? And I think this is an important point to make. So under phase 3, museums will be reopening later in phase 3. Museums will not be reopening immediately as of today in phase 3. However, if you have a retail shop within your museum, you can open that retail shop. And basically what we're saying is if you have multiple kind of industries within one location and one portion can open and one portion can't, then you can only be reopening the portion and following those guidelines for that section. So the prime example is a museum with a retail shop. That retail shop can open, but the museum portion should stay closed for now. Great question. Is this presentation available in Spanish? So this specific retail presentation is not available in Spanish. However, we conducted an overview of all the guidelines presentation in Spanish last Friday, and that goes into some detail on all of the different industries, including the retail. It doesn't go into this full retail detail. So I asked folks, if you're looking for this information in Spanish, you can view that presentation in Spanish, and then let us know if you have any questions and we can get those answers. So again, I apologize if I didn't get to every single question. Please follow up via email and we'll get you your answers as quickly as you can. I do want to very quickly though, talk about the self-compliance efforts that we have in place for folks. So first, there's this Be Safe Chicago self-certification pledge. We encourage all employers to take the Be Safe Chicago pledge, which again, and I'll type it in again, you can find at chicago.gov/reopening. Please complete this self-certification on this website in order to get a badge and to show that you are reopening and that you know the rules for reopening for your industry. There's the Be Safe Chicago pledge right now for phase 3. And as we continue to transition to phase 4 and phase 5, we will be updating that pledge. And one thing we're excited about, in addition to just the Be Safe Chicago pledge, you can get one specifically for your neighborhood as well. Be Safe Austin, Be Safe Chatham, Be Safe Lincoln Park, to show a little pride in your community as well. And the reason really for you to do this is threefold. First, you can read the guidelines, you can listen to me talking about them, but by reading them over in this pledge and verifying that you're doing them, we're ensuring that you know them in a little bit more detail. So for you, the business owner, this gives you another opportunity to make sure you understand and get answers to the questions you might have about reopening. Second, it shows your workers that you're pledging and committed to reopening safely. When they see that Be Safe Chicago pledge on your door, they will know that you're reopening safely. And then finally, it tells your customers that this is a safe location. So we do strongly encourage folks to take the Be Safe Chicago pledge. Finally, I know there's lots of questions about how to get affordable PPE, personal protective equipment. And that's why we have established the Chicago PPE Market.com for you to get affordable and verified PPE, protective shields, hand sanitizers, face masks, face shields, things like that. You can find, this has been stood up by a local startup, and it's for small businesses, community-based organizations, and nonprofits. So please, I recommend you all to check out this site if you haven't already. I also want to remind folks that all of these guidelines can be found at chicago.gov/reopening. And if I didn't get to some of your questions, I know there's a couple that came through that I'm unable to answer, so I do ask that you reach out to the outreach email, and I will get you an answer to those questions immediately, perhaps because they fall a little bit outside of my department, so I'll make sure to get those answers to you quickly. But I do want to thank you all for your time. I'll be around for another minute or two to answer questions, but that covers the content for the presentation. And thank you all very much for your time. And good luck as we enter the cautiously reopening. Thanks, everyone.